We will keep this short and brief, but really this is an informational press conference, but it's one that is timely, it is one that is topical. It's one that we want to be out in front of in ensuring that people are as informed as they need to be about the Zika virus. The Zika virus is something that people have heard a lot about, not so much in Kentucky, but it's topical. And as we head into the season where people are starting to think about spring break and where they might go, as people are thinking about service projects and mission trips and any number of other things that might take them into Zika virus-infected areas, it's important for Kentuckians to start to think about what the impact could be on our state. We did actually have the very first confirmed case of somebody who is a Kentuckian with the Zika virus. To the best of our knowledge and that of the Center for Disease Control, or the CDC, there is an individual who had traveled to a region in Central America where they were, what's the word I'm looking for? Basically contracted, thank you very much, this disease. And that is the only Kentuckian we're even aware of for whom this has been an issue. But this caused us to realize the greatest ability to be prepared for anything that might come is through education, through knowledge, and through forward thinking. And so being proactive is the point of this. And we want you all to help us in this, which is to communicate to people how they can best be aware of what's up, how they can be prepared, how they can make informed decisions, and where they can go to get that information. So to that end, I'm going to ask Secretary Glisson, Dr. Humbaugh, who are both responsible for overseeing this within the Cabinet for Health and Family Services, to address what we are doing in terms of communication, not only with other states, but with the Center for Disease Control, et cetera, the communication plan that is in place. And then we'll be happy to address any specific questions that you all have. Thank you.
I wanted to let everyone know that we feel that we are prepared. The Cabinet for Health and Family Services, particularly through our Department for Public Health, has been preparing for a potential Zika case for several months. This is something that all states across the union have been working on. They've been asked to work with the CDC, the Center for Disease Control, and to be prepared in case you ever have a Zika case that erupts in your state. And so I wanted to be here today to let you know that we took this admonition from the CDC, from the Center for Disease Control, very seriously. And I'm pleased that Dr. Humbaugh has been spearheading that effort for our cabinet, and he has been communicating regularly with the CDC. And in fact, just this morning, he was on the phone call with them, and we have folks at the cabinet right now on a webinar with the CDC. They do hold regular conference calls, regular webinars. And what they've asked us to do months ago was, would we put together a state action plan? And they have given every state, when they've had these calls, they've given guidances on what that state action plan ought to encompass. What should it look like? And so we have been busy working on that, and so I wanted folks to know that we do have a plan. We feel that we're prepared. We're going to continue to prepare. We're going to continue to refine that plan. Part of that plan deals with communication, exactly what we're doing today. That if you end up and you find out you may have a case, if you have someone that's traveled out of your state and you have a Zika virus case, what do you need to do? What do you need to communicate with the folks in your state so that they'll know what to expect, the precautions they need to take? So we have developed a communication plan. We're also doing a lot more surveillance. We want to be mindful. We want to be watchful, particularly for folks that are traveling out of the country right now and into Zika-infected areas. We're reminding clinicians, hospitals, and so forth, be watchful in your emergency rooms. Be watchful about the patients that may end up in your offices. So it's been helpful to make sure that we just remind hospitals and clinicians that you may have a patient that may come, and these are the kinds of symptoms you may see. And if you see these symptoms, you need to know that you may need to let us know because they may have the Zika virus. One of the things you're going to be hearing from us as we go into the mosquito season, spring will be here soon, and summer, is that we are looking to do a lot more vector control. We're going to have to be mindful, like they are in other countries, to make sure that we control the mosquito population. And so one of the things that we've been asked by the CDC is to make sure that we reach out and we build partnerships. And so we have been doing that. We're working closely with the emergency management folks, like Mike Dossett here, that has been working with us, and certainly the Department for Agriculture. We have been working with the Department of Agriculture because they do spraying. They have the ability to go in and spray for mosquitoes. So you may be hearing more from us on this communication plan as we go forward about how we can control the mosquito population. Simple things we can do. Put screens on your windows, things that we remind people. Don't let old tires sit around in your yard or in your, around a building that might capture water, and you may have mosquitoes that may breed there. So we're going to be doing a lot of reminders to folks to keep the mosquito population down. And we're looking forward to developing more partnerships. I really want to thank Mr. Dossett for being here today, and I want to thank Commissioner Quarles for working with us closely. And I think that the person I'd like to turn it over to next is Dr. Craig Humbaugh. Dr. Humbaugh is our Senior Deputy Commissioner of Public Health at the Cabinet for Health and Family Services. And Dr. Humbaugh is the physician that has been spearheading this for us, and I think he can talk a little more about Zika, the virus, and some other particulars and details. But I mostly just wanted folks to know that we have been getting prepared, and we are prepared as we move forward. So I'll turn it over to Dr. Humbaugh.
Thank you, Secretary Glisson and Governor Bevin. Appreciate it. So I'll start out by saying that most Kentuckians are not at risk for Zika virus infection unless they've traveled recently to Zika-affected areas. Most Zika-affected areas are in South America, the Caribbean, Central America. There are a few other places in the world that have mosquito populations where Zika is circulating. Zika, as you all have heard, is a vector-borne illness, and that's just a fancy way of saying that it's transmitted by mosquitoes. They're the vector in this case. The virus is transmitted by them. And right now, we're not in mosquito season here in Kentucky. Pregnant women are advised specifically not to travel or delay travel to Zika-affected areas. Why is that? Because most people who have Zika virus infection actually have very mild cases, or they're not even symptomatic. But the concern is that pregnant women, there's increasing evidence that pregnant women who get infected with the virus are at increased risk of giving birth to babies who have birth defects that involve the developing brain. So we use the term microcephaly. It simply means small head or brain size. And there's increasing evidence that there's a link between this infection during pregnancy and babies who are delivered with types of brain birth defects. We already surveil for brain birth defects here in Kentucky in our Kentucky Birth Surveillance Registry, but we'll be doing some additional work to try to pick up on surveillance of folks who may have traveled. As Secretary Glisson said, we've already done some work trying to educate providers in the state about which patients might be indicated for Zika virus testing. And those specimens are being sent to us. We're in turn sending those to CDC for testing. Right now, there is no, unfortunately, vaccine for against Zika virus. There's no specific treatment. The treatment is generally symptomatic treatment for people who are infected with the disease. The most common symptoms of Zika virus, if people do have Zika virus, are fever, rash, joint pain, and conjunctivitis, which is red eyes. So, and those are pretty common, pretty common symptoms of other things as well.
Any questions that any of you have about this on any front?
No. You said you got a plan in place. Does the fact that you have a positive Kentucky resident change anything or move the plan forward in any way at all?
Well, again, I think it gives us opportunity to help the public be more aware of what's happening in other areas, to make sure that they understand that any travel to Zika affected areas, they should take precautions to not get bit by mosquitoes. And that includes wearing approved insect repellents, long clothing, long sleeve clothing, trying to avoid going out during times when mosquitoes are most active. That's usually dawn and dusk. So it's a great opportunity for us to try to educate folks about travel and travel-related illnesses right now.
Doctor, this gentleman who contracted the disease, what type of treatment? Is he quarantined, or what do you do?
No, there again, this is in general primarily a disease that's spread by infected mosquitoes. Now, you have probably heard that there is another mechanism, at least one other mechanism, and that is through sexual contact. And at this point, he's been advised to take precautions in terms of sexual activity. At this point, we would advise any folks that come back, if it were mosquito season, to actually wear repellent so that they wouldn't be bit by mosquitoes here in Kentucky. Does that make sense?
It does. How long will he be affected by this? What's the...
Well, he's recovering now and doing well, expected to make a full recovery. We don't know how long the virus will stay in semen, for instance. I think that might be your question, and we don't know. So stay tuned. This is an evolving situation. Centers for Disease Control and Prevention is learning about Zika virus in these countries that are affected right now, and that will help us to know more about it in folks that are travelers that may become infected from Kentucky.
Can you say anything about how he was identified? Did he present to an emergency room or doctor's office, or how anyone picked up on this?
Well, he had symptoms of a rash and fever, and had recently traveled to Central America. So he fit the criteria, possibly having Zika, and an astute clinician saw him and sent in a specimen.
Should pregnant women in Kentucky be worried even if they're not traveling, but just here now that this case is here?
Mm-hmm. Again, if they're not traveling, they should, in general, not be exposed to the virus. So the primary mechanism of spread is through an infected mosquito bite.
Does Kentucky even have that mosquito? I understand it's only certain species of mosquitoes
Yeah.
that spread the disease.
It's a great question. We do have Aedes aegypti, but they're very small populations from what I understand from our mosquito experts. Our entomologists at the University of Kentucky have been advising us on this particular area. However, we have other types of mosquitoes that may be what they call competent vectors. In other words, they may be able to spread the disease, but at this point that hasn't been shown that these other mosquito types are competent vectors. So there again, that's part of the evolving story.
So will the state be monitoring that mosquito population to see if Zika shows up?
Yes, so we do monitor the mosquito population actually every year, and as you know, we are also worried about other mosquito-borne diseases such as West Nile virus, which is now endemic in Kentucky, and types of encephalitis that are carried by mosquitoes. But we will be increasing our surveillance in different geographic areas. It's impossible to test every mosquito, but that will be part of the action plan that Secretary Glisson talked about.
You mentioned approved repellents.
Mm-hmm.
Can you give an example of what's approved and what's not approved?
Yes, so I think the best place is to go to the EPA's website, and they have a list of approved repellents, but those with the active ingredient DEET, and I think most people know what that is, are effective. Some other repellents may not be as effective, and we certainly want people to be using approved repellents that are going to be effective when they visit these areas.
You mentioned surveillance of people. How's the state going to reach folks who traveled overseas and then came back, I guess, to inform them about the
Why we're
virus.
having this press conference.
Yeah.
Well, you're not gonna reach everybody.
No, exactly, but we're gonna reach a lot more than if we don't have it.
So, yeah, we want them to be informed before they go travel, but if they do come home and they do exhibit signs and symptoms of Zika virus, then obviously we want them to consult their physician and want their physician to give us a call to talk with us about whether testing is indicated.
Is there any concern that there are folks who have traveled abroad and come back contracting the Zika virus and not being aware of it?
Again, many people are asymptomatic or don't have symptoms. In fact, most people either have mild symptoms or don't have symptoms at all.
Is the patient recovering at home or in the hospital? And if he was in the hospital, how long did he stay?
I'm not aware that the patient ever was hospitalized and is recovering at home as far as I know.
So the only way it can be transmitted from human to human is either through pregnancy or through sexual.
That we know that now. We also could potentially be transmitted through a blood transfusion. That's one of the reasons that blood donor organizations have asked folks to defer blood, donating blood after recently returning from a Zika-affected area. Again, we're learning more about the virus, but we know the virus is potentially circulating in the blood and other body fluids at the time that people are sick, and that's why those recommendations have been made.
Are the feds giving money to states to do this, more money, or will this be additional cost to the state?
We'll be looking for opportunities that the federal government may have for additional resources in this area.
I had a meeting 2 weeks ago in Washington with a number of governors, with the Secretary Burwell, who is the Secretary for Health and Human Services, specifically on this exact topic. And the dollars are there to the extent that they would be needed. There are some states, and frankly some of our territories, in the Caribbean that have more immediate need, and that is where the focus is right now, not only in terms of the knowledge and the attention, but also any dollars that would be dispersed. It's important to understand this, and this is where I truly ask of you all to partner with us in this. This is so far out in front of this being an issue for Kentucky, but it is intentionally so. We want people to be informed. And one of the things that I'm going to ask Jessica, if you could make sure that everybody who's here has links to all of the information that we have available. We have websites that have already been put up, links to those that are not only the state's contacts for information, but also those at the CDC, the EPA, et cetera, some of those that have been alluded to. Help us steer people, help us shepherd people toward the information they need to make informed and thoughtful decisions so that they can take control of their own outcomes in some respect by mitigating any potential they have for risk. And these are the kind of things that us being out in front of us, working together with you, is exactly how this will never be an issue for Kentucky if we play our cards right. And it should not be, but we don't want it to be because we did not communicate. So expect more of these type of things from us as we move forward. And even, Mr. Dossett here, who oversees all of our response to any kind of things, whether it's snowfall, clogging up the highways, or whether it's this. I mean, there is dialogue that happens on a regular basis, much of which never elevates itself to the point of having this kind of conversation. But when we think it is in the public's best interest, the primary catalyst is the fact that spring break is coming and people are starting to think about where they're going to go and what they're going to do and talk about these issues. We want you and your viewers to be as informed as anybody in Kentucky. Any other questions of anybody who has spoken?
What country the patient is in?
At this point, to be specific about a country, when someone travels in a region would add information that is not value added. So it's better for people to focus on what are those regions: South America, Central America, the Caribbean. These are the areas as a whole. There's no mosquitoes fly over the border every day, as you can probably imagine.
Does the Zika patient in Kentucky live in Louisville?
Again, in fairness to this patient and this patient's privacy, the specifics about this individual and who they are and where they live is best kept private. It really is, out of respect for them. And I would encourage you to understand that too. I mean, while it's fascinating to try to figure out who it is, understand this is an individual who wasn't looking to be the first person in Kentucky. who might have contracted this.
One more question.
Is the state putting out any publications to any universities or high schools who may be going on spring break trips to, hey, look out for Zika?
We've not yet sent direct information to them, but this is exactly the point, again, of this press conference and of the websites that we have and the links that we will make available to people. Because to the point that was made earlier, you can't reach every single individual, but you use the mediums of communication that we have to reach as many as we possibly can. And the biggest issue is for people to start now, to be proactive, to get out in front of this, and to inform themselves. And that would include teachers and leaders of any kind of a group trip or whatever the case might be, to make thoughtful, informed decisions, what they think is the best for their particular group. Thank you all.
Governor, one quick one if I may. It just dawned on me with the spring break, we've talked about Central and South America. Are we beginning to be concerned about the Florida and
Olympics?
Gulf Coast?
Well, I mean, sure. I mean, of course. And well, already, and I say of course, I mean, the CDC has already noticed that whether it's Florida, whether it is Texas, whether those states that are the closest to those infected areas are the most susceptible to having a prevalence of this. That's why Kentucky doesn't have a concern on this front. But again, I wouldn't be alarmed by it. I would just use the exact same form of discretion and proactive thinking that we've been calling for here. Thank you all very much. Appreciate it.